Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Welcome, everyone, to the Friendly Pharmacist podcast. I'm your host, Nario Cantu, from Cantu's Pharmacy, and today we're diving into a revolutionary topic that's changing the way we approach healthcare: personalized medicine. Over the past few decades, healthcare has been evolving, moving from a one-size-fits-all approach to something far more tailored and precise. We're talking about medicine that is shaped and optimized based on individual genetic profiles, giving rise to what we now call personalized medicine. Today, I want to walk you through personalized medicine, the incredible advances that have been made, and what this means for patients and healthcare providers alike. So, let's start with the basics. What is personalized medicine? Often referred to as precision medicine, is an innovative approach that takes into account individual differences in patients' genes, environments, and lifestyles to create more precise, predictable, and effective treatments. Instead of relying on generalized treatments that may work for some but not for others, personalized medicine uses information about a person's genetic makeup to guide decisions made about prevention, diagnosis, and treatment. At its core, personalized medicine is about moving beyond the trial and error method of treatment. How many times have you seen patients return after trying multiple medications for the same condition, frustrated because they're not getting the relief they need? Personalized medicine aims to eliminate that guessing game. By understanding a patient's genetic profile, we can predict how they will respond to a particular treatment, whether it's a medication, therapeutic intervention, or even lifestyle changes. What role does genetics play in personalized medicine? Now let's focus on the genetic aspect of personalized medicine. In recent years, advances in genetic research have opened up a new frontier in healthcare. Each of us has a unique genetic code composed of about 20,000 genes, and within that code lies valuable information that can help predict how our bodies will react to different treatments. Some of the key advances have come from pharmacogenomics, a branch of personalized medicine that studies how a person's genes affect their response to drugs. For example, some individuals metabolize drugs very quickly, which means they might need a higher dose to achieve therapeutic effects, while others metabolize them slowly, risking toxicity even at standard doses. This is why two people with the same condition might respond differently to the same medication. By using genetic testing, we can now customize treatments based on a patient's metabolic profile, reducing side effects and improving efficacy. This approach is already making a significant difference in the fields of oncology, cardiology, psychiatry, and more. Let's briefly discuss the applications in cancer treatment. One of the most promising areas where personalized medicine has made great strides is cancer treatment. For years, cancer therapy followed a more generalized approach: chemotherapy, radiation, and surgery, treating all patients with a specific type of cancer in the same way. However, we've learned that not all cancers are the same, even when they occur in the same organ. Now, thanks to personalized medicine, we can analyze the genetic mutations driving a particular cancer. Take targeted therapy, for example. Drugs like Herceptin are designed to target specific genetic changes in breast cancer cells, which means patients with a certain mutation in their tumor's DNA are more likely to respond to that treatment. Another breakthrough is immunotherapy, where treatments are developed based on a patient's unique immune response, enabling their immune system to recognize and attack cancer cells more effectively. The shift from blanket treatments to more focused, gene-based therapies is helping cancer patients live longer, with fewer side effects and better quality of life. How about cardiology and psychiatry? It's a new frontier in these specialties. Personalized medicine isn't just limited to cancer care. It's rapidly advancing in other areas too. In cardiology, genetic profiling can help identify patients at risk of heart disease, allowing for earlier interventions. For instance, some individuals carry genetic mutations that affect their cholesterol levels or blood pressure, and knowing this ahead of time allows doctors to prescribe more effective medications or suggest lifestyle adjustments that can prevent future cardiovascular events. In psychiatry, where finding the right medication for conditions like depression or anxiety can often take months or even years, genetic testing is beginning to play a critical role. For instance, CYP450, which stands for cytochrome P450 testing, can provide insights into how patients will metabolize antidepressants, antipsychotics, and other psychiatric medications, reducing the trial and error process and leading to faster, more effective treatment. Let's examine the impact on pharmacy practice. So, what does this mean for us as pharmacists? Our role is becoming more crucial than ever. Pharmacists are often the bridge between the patient and the doctor, and with personalized medicine, we can ensure that medications are not only prescribed correctly, but that they are optimized for each patient. By staying informed about pharmacogenomic data and genetic testing, we can counsel patients more effectively, help adjust dosages, and prevent harmful drug interaction. In the near future, we may be regularly collaborating with healthcare providers to interpret genetic data and make recommendations tailored to individual patients. Imagine a world where every prescription you fill is accompanied by a genetic report that guides you in determining the safest and most effective dose for your patient. That's where we're headed. What challenges are we facing, and what will be the future of personalized medicine? Now, personalized medicine isn't without its challenges. Genetic testing can be expensive, and not all insurance plans cover it yet. There's also the issue of data privacy. How do we protect sensitive genetic information from being misused? Additionally, while we have made great strides, there's still much to learn about how different genes affect health and disease. However, despite these challenges, the future of personalized medicine is bright. As technology advances, we'll see genetic testing becoming more affordable and accessible. And with that, treatments will continue to become more personalized, more effective, and more aligned with each patient's unique biology. In conclusion, personalized medicine is revolutionizing the healthcare landscape, from targeted cancer therapies to optimizing cardiovascular and psychiatric care. This approach allows us to move away from the traditional one-size-fits-all method and toward a future where treatments are tailored specifically to the individual. As pharmacists, we have an exciting opportunity to be at the forefront of this revolution, helping to guide patients through the process and ensuring they receive the best care possible. It's a new era in medicine, and we are fortunate to be part of it. Thank you for joining me today on this deep dive into personalized medicine. Stay tuned for more episodes of the Friendly Pharmacist podcast, where we continue to explore cutting-edge topics in healthcare. Until next time, be safe and be well.